All right, I'd like to call this meeting of the West South Milwaukee School Board to order, and I will lead us in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, Sarah, would you please call the roll?
Yes. Mr. Keller is excused tonight. Mrs. Kaiser. Here. Ms. Deal. Here. Mr. Burns.
Present.
Mrs. Carr is excused. Mr. Sikich.
Present.
Mrs. Lee. Here. Mr. Becker.
Here.
President Lee.
Here, proper notice of this meeting has been posted in accordance with the open meeting laws of the state of Wisconsin. Do we have any modifications to the agenda this evening?
There are no modifications.
All right, we'll move right into the superintendent's report.
Thank you. Legislative updates. November will see the election of half of the 33 Senate districts and all 99 Assembly districts, with major legislative redistricting and long list of retiring legislators. Significant turnover is expected in both chambers next session. This could bring changes to longstanding relationships with state legislators. The Wisconsin Alliance of School Boards aims to provide school leaders with the resources they need to stay updated on changes and understand how their advocacy efforts could be effective. Our district recognitions. Last week, the Nathan Hale cheer team brought extra spirit to BMP Care's final Alzheimer's Association fundraising event of the year. Thank you to Coach Gunther and the cheer team for their contribution and for representing the district. So again, shout out to those young ladies who participated and supported the Alzheimer's Association. West Allis Central, congratulations to the West Allis Central Bulldogs for being selected as the WSN Football Team of the Week on September 5th. So even though this has passed, we have not had a board meeting since then to make that official recognition. So thank you to all of the 2,661 people who voted, and people may have been like me who voted multiple times. West Allis Central Bulldogs have been selected again as a team of the week. They actually ended a 44-game losing streak. So this is a great accomplishment. And in talking to Brian Summerfield, principal, he said it was just a shot in the arm that his school environment needed. So special shout out to those young men who defeated Brown Deer by a score of 20-19. And so again, congratulations to the West Allis Central football team. All right, so in the past week and a half, a Quadrant B superintendent's meeting. Bruce with the mayor. I want to thank everyone who came out and who heard all of the information that's occurred within our district within the last year, as well as information concerning the upcoming referendum. A policy review meeting with Neola. Attended the West Allis Rotary Club meeting, referendum presentation that will occur on October 10th. If anybody's interested in coming to Rotary, we would love to have you October 10th. We'll do a presentation at that particular meeting as well. We've also participated in the referendum canvassing event, had one-on-one meetings with board meetings as well as past board meetings. Had one on today as well. School visits, examining the Chartwell Food Services contract, the new contract we're under. Been sitting around talking with students, talking with the workers as well, trying to figure out how we can improve if there's any areas of improvement, and just trying to get a feel of how that particular service has gone from their experience beginning the school year. And then I also had some targeted visits at elementary schools, in particular looking at special education services within our schools, mainly our ID programs and some areas where we have students who are coming into our district who are having some, what I would say, extra behavioral problems or concerns. And so we're just trying to figure out, what are we doing? Are we servicing these kids in the proper way? So that was a visit that I had the other day at some particular elementary schools where some concerns have come up. So I am short and sweet tonight. That's the superintendent's report for tonight.
All right, thank you very much. Move on to item 7, public comments this evening. I don't see anyone here in person. If there's no one in the Zoom, there should be a link in the Zoom chat to be able to sign up for public comments. Currently, there's no one signed up. I will wait 15 seconds to allow someone, if they are on Zoom, to fill out the form if they would like to address the board. Seeing no additional signups, I will close public comments at this time. Move on to item 8, board reports this evening, starting with 8.1, review of the board calendar. Today is Monday, September 23rd. We have a regular Board of Education meeting to start at 6 p.m. Next meeting is on Monday, October 14th at 6 p.m. We're going to regular Board of Education meeting and then a fall screener data presentation. Then on Monday, October 21st at 6 p.m., we have a board workshop meeting with a topic that will be determined later on. And on Monday, October 28th at 6 p.m., a regular Board of Education meeting where we approve our final budget and tax levy as well as a DLVA workshop. Moving on to 8.2 board committee reports, starting with 8.2.1 employee engagement and culture. I believe Mr. Burns is doing that today.
Yep, that would be me. Thank you. So we met on the 17th of September, and it was really a kind of a record book kind of a meeting. We were talking about a lot of the things and just pieces that we were covering to clear up and make sure that they were set for this upcoming year. And so big thing that keeps coming is our employment or our vacancy listing, and we're still, as of the 17th, down under 1.5%. So it's doing very well. We're still looking for those couple of last positions. As of the 17th, I don't know if anything has changed since then. We also talked a lot about what the HR committee HR team is doing with really getting into the schools, maintaining positive relationships within the schools, and really getting that face time so that people feel comfortable talking to them, coming to them, discussing anything that might be of interest for them or for the culture of the schools. We also talked about that they are looking into and verifying all of our licensing, make sure all of our teachers are licensed and everything is updated for that as well. And then they also were looking at doing a website update, making sure that all of our contact information is correct, making sure documents are up to date, and they're working with the communications team on that. So quite a few record keeping kinds of things. Talked about some maybe future things because we have been working a lot with our surveys and getting that feel for what our district staff is thinking about the district and how things are going. And so we were looking at maybe expanding a little bit of survey stuff to looking at also doing some of our interns that we bring in to see how we might be able to keep them or encourage them or develop that program for them more, as well as doing that for student teachers in the district, and just seeing so that we can work from two fronts of recruiting, make sure that we've got good established training for those student teachers coming in, and then maybe we can keep some more of them in there. And I think, and then we also talked about reaching out to the Teachers Association to see how they think things are going and if there's any kinds of opportunities that they might see that would be good for us to talk about and see if there's things that we can do to help make the district better. So other than that, that was all we talked about, but it was a very much seeing where we're going and getting this established for the upcoming year here.
All right. Thank you very much, Mr. Burns. Does anyone have any questions for Mr. Burns regarding his report? Or any items to consider at future agendas?
For future agenda, could we put on there to discuss the possibilities of going back to paper and pen comment boxes in all the schools? Yeah,
Okay.
just so people really feel that anonymous, there's just a lot of chatter that people they want to express, but they are nervous how to go about it. And it seems like paper and pen comment boxes is making them feel more comfortable.
Oh, so you're talking like feedback kind of boxes?
Just
those
feedback,
Got it.
just
Okay.
things, whatever's going on in the atmosphere that they're in.
Sure,
Yeah.
sure. Put that on there. Thank you.
Any other items to be considered at future agendas?
No.
Seeing none, thank you very much, Mr. Burns, for that report. Moving on to 8.2.2 Recreation and Community Services, Mr. Becker.
Thank you. The Recreation Committee met on the 16th, last Monday. The big first item that we spoke about was action program staffing. We're short-staffed both before and after. It seems like in the afternoons, we have a little bit more. There's a greater pool of employees with the high schoolers who help to run those programs. but the mornings are a real challenge. There's a wait list. I believe my notes say Irving, but I think I may have seen something else. It is Mitchell, right? In the notes, that's what I thought I saw. Thanks. Shelley's nodding vigorously in the back. Thank you. So we talked about some ways to try to drive some more people toward those. So we're looking at increasing select salaries and seeing what the impact is. Mr. Sickich had a great suggestion to see what a senior center advertisement might do. Encourage some folks who have a little bit of time looking for a little bit of work. So we'll keep you guys updated on that. We also spoke about budget priorities for the rec. The discussion was that the levy hasn't changed in a long time. And with increased responsibilities and just the scope of what the recreation department does, trying to understand what exactly are the non-negotiables, what are the programs that we absolutely have to keep. We spoke about inviting our finance expert to the committee to come and give us some guidance on how to begin to prioritize exactly what we're going to do. So looking your direction, Mr. Lawrence. But that again will be a work in progress, and we'll bring it to the board when we have a little bit more meat in those bones. For the future discussion, we spoke about the co-op for the feeder programs. We have no junior Bulldogs boys basketball this year. At least part of the issue is we don't have enough coaches. Not sure exactly what the other issues are, but it was a pretty brief discussion that quickly spiraled into just a general frustration with the lack of opportunities for the youth sports. We all agree that no sixth grade sports for our middle schoolers is kind of a difficult one to swallow, even though it might be the norm in the region. It is still not what we want to see. So we were kind of talking about some advocacy and trying to think about some ways to drive that conversation and help to feed our high school programs a little more effectively. That was about all we covered.
Thank you very much, Mr. Becker. I'm going to jump around. Did you say no sixth grade sports? Is that what you said?
For the middle schoolers, yeah, there's no school programs. The middle schools themselves don't have teams. Like there's 7th and 8th grade basketball, but there is no 6th grade basketball, no volleyball, no.
I mean, there's opportunities for some sixth graders to join like cross country and stuff like that, but it's not a specific sixth grade.
Right. There's the I think my kids
There's
did
cross
that at
country,
Lane.
volleyball, right? And then
Right. There's like an intramural, like to do a softer schedule. I think they had one meet for the track kids at 6th grade, which
okay.
is still not the same as what the 7th and 8th graders got, which is,
Right.
4 or 5 meets, something like that.
Okay. All right. Other questions, Mr. Burns? Do you have a question?
Question, because my son did cross country, so I thought that they had, but is there a reason we don't have the 6th graders just join the middle school teams and run it as, because that was what we did. One of the schools that I've been at, we just brought the 6th graders along for track and field.
My understanding as a parent was that it just wasn't, they were just not permitted, that they only had opportunities to do like a limited participation just at the one meet.
Explore that. for the future
Shelley, do
agenda.
you have anything you want to add on this conversation? I just want to make sure we have the right information.
Yeah,
You gotta come on over.
At the intermediate school level, sports are available, cross country for 6th graders, but basketball and volleyball, there's nothing for 6th grade. So basically for our 6th graders, it's cross country, wrestling, and then limited track meets. They don't get the same number of meets that the 7th and 8th graders do.
Is that a WIAA rule or is it just what we?
We're not a WIAA member for intermediate school sports, and the majority of schools in our area are not. Yeah.
I know we mentioned one time that there was also a scheduling problem
Mhm.
when you have 6th grade sports because of the area schools don't have them. So who would you play against? I remember the conversation.
Yeah.
Have we explored, I mean, I don't know how long this has been in place, but is there any sort of intermediate school sports meeting that the area people, or is there an email list or a Zoom link?
No, that's the challenge we've had. Like, we have reached out, so there's quasi kind of conferences but there's no conference for cross country and track. Wrestling has its own conference, like it operates as its own kind of sport.
Mhm.
And then basketball and volleyball, the conference we're in, the schools are far. We've tried, West Milwaukee was able to get into a area conference for just 1 year to fill a spot till another district that was already in the conference added another middle school. So then we kind of got bumped. But yeah, that's what makes it very challenging. It's not governed, intermediate school sports are not governed by any one
Sure.
organization or association.
Thank
The
you.
other thing I'd kind of wondered too is even if we would just do some kind of a basketball club or a volleyball club, something of that sort to include our sixth graders and give them an opportunity. I know that there's one teacher I know who came over with the lane move, had expressed a little bit of disappointment because the opportunities the coach had dried up. There's just nothing there. So I wonder if finding some way to do it in an informal way might be another way to go.
Well, you're on the committee. And I don't
Motion to
think that's a terrible idea at all. Even within our own school to do that, to provide that, and then, you know, the coaches for the 7th and 8th grade could have some involvement with that since they might be seeing some of those students the next year.
Hmm.
So, but, you know, figuring out logistics of that, making sure we have equitable availability for that for our sixth graders at both West and at FW, I think would be a good thing to consider. But yeah, I think that sounds like a possible solution. Ms. Kaiser,
Could we open up to high schoolers who need volunteer hours,
for what, coaching?
like with sixth graders?
I possibly, I don't know if the issue is lack of coaching. I think right now it's just, it doesn't exist. So we'd have
Oh,
to
okay,
create
okay.
it and have a
Yeah.
process for doing that.
Sure.
We would need a teacher if it's a club,
Yeah.
we'd have to have a teacher, you know, somebody who is responsible for overseeing said club.
Sure.
So if there was a coach that was like, I can't do this anymore as a coaching perspective, but hey, if there's a club, I'll be in charge of that club and then I can get some of the coaching, that'd be great. For that perspective. Any other questions for Mr. Becker regarding his report? A lot of lively discussion on this one. I'm actually personally happy to see that we're thinking about co-oping our feeder programs, because I do know that one school or another can miss out on opportunities because there just isn't one for one score or the other. So it isn't just central in this instance, but in Hale, there's been other instances where there has been a feeder program for there. So I think if we can figure out a thing, because I know there's still some territoriality, that's not the wrong word. There's territorial aspects to this still. And I think it hurts the kids sometimes because then the opportunity isn't there.
Mhm.
So if we can figure out a way where it's like, well, if there isn't an opportunity here, then we would co-op. And that would just be like the understanding, like we don't have a coach or we don't have enough kids to field the team in one or the other. So you guys are going to co-op and that's just going to be how it works. So
Mhm.
I'm hoping that maybe something of that nature could be discussed and hammered out and agreed to.
100%.
All right, any items for future agenda topics? Seeing none, thank you very much, Mr. Becker. Moving on, 8.3, board member reports of community events. Anyone attend events they would like to report on? Ms. Kaiser.
I was at the first campus. Shout out to Mr. Norris and Ms. Hahn and everybody else involved in it. It was really fun. It was really fun. Actually, I was in my neighborhood with Ms. Carr, and very, very few people knew about the referendum, despite a lot of hard work. But we had a lot of people very receptive to what we're asking. But it was really nice to just talk to neighbors and really get out there. I encourage anybody who even is considering it, come on out. It's really easy. It's really fun. It's not, it's a great way to meet folks, and just everybody who showed up that first day, just thank you so, so much.
Absolutely. Thank you very much, Ms. Kaiser. Anyone else like to report on events they attended? Mr. Becker?
I also made it to the Brews with the Mayor that Dr. Robinson referred to over at Perspective. That was a nice event. So thanks to the mayor for providing that forum. I also ran into the mayor at Coffee with the Mayor on Friday over at the Ethiopia Coffee Shop over on Greenfield that just opened up. I'd actually gone there for a neighborhood concern, but he immediately identified me and spoke about the school board. So I ended up speaking with a couple citizens and providing some information from the referendum after we had our conversation. So Also got to meet one of the grandparents of some kids in the special ed programs at one of our schools.
Mhm.
She'd emailed before, but it was nice to get to put a face to the name.
Absolutely. Thank you very much, Mr. Becker. Anyone else want to report on events they attended? All right. So 8.4, the only thing that I want to talk about is we do have our first referendum engagement session coming up this week at West Milwaukee Intermediate. It's on the 26th, 26th on Thursday. That starts at 6 p.m. Correct? So this is our first engagement session after the board has approved the questions. So now we know the what, the how much. And so if encouraging anyone out there listening, if they have any questions or concerns or just want to discuss about what we're looking at doing, what these referendum questions are about, I encourage you to come out. This is the first one. We will have others, but this will be at West Milwaukee at 6 p.m. in the theater. Auditorium. Yeah, okay. Liberace, sorry. Great. All right, that's all I had. So move on to item 9 this evening. Our consent agenda, 9.1, approval of a budget hearing and regular board minutes from September 9th, 2024, as well as our board workshop from September 16th, 2024. 9.2, employment summary, 9.3, supplementary contracts, and 9.4, financial summary. Does anyone need anything separated out?
Move to approve.
Second.
Moved and seconded. Any last minute discussion? All those in favor? Opposed? All right, that passes. All right, we'll move on to item 10, our action item this evening, 10.1, 2025 health insurance renewal, Mr. Norris.
Great. Well, thank you everyone this evening. I won't spend a ton of time on this evening, but I do want to give you guys a short recap of kind of the discussions that have been ongoing between us, our consultant Brown and Brown, and certainly our staff here over the past few months. So I have a short presentation. A lot of it'll be things we discussed last month at our workshop, but I want to just kind of get our minds back into it before we have a discussion, final comments and thoughts. So quick agenda. I want to kind of quickly go through kind of timeline, the different discussions we've had, kind of what was discussed when, discuss briefly the loss ratio, the renewal we received, and then discuss a bit on the UHC ACO network, which will be what's recommended this evening, to provide you both with kind of the what and also how that impacts current staff from a disruption perspective. And then also give you some final considerations and recommendations, and then also give you kind of like a looking ahead. So should you approve the recommendation this evening, kind of what would the next month and a half look like with some kind of forecasted sessions for staff and communications. So again, priorities in terms of benefits, we really always tried to maximize employee benefits. It's been kind of one of the pieces of the district from a compensation perspective that has been maintained and has really post Act 10 been something we've been really strongly committed to as a district for our staff. So really try to maximize those. Any renewal, we're going to consider things costs, both to the employee and the district. We look at disruption, and then at some point, should we have to make changes, we consider, well, what changes again would impact employee retention. So if we make massive changes to health insurance, likely that would have some retention results from staff who have stayed because of those benefits, right? So a quick timeline, we started discussing at the board level with the committee in May. Again, in June, we had a full workshop number 1 in July. I brought back this information post workshop 1 to my committee in August. And then, as I mentioned before, we had a workshop last month to kind of bring back the full circle. Where did things land with the renewal, RFP, the ACO network last month, and then tonight, recommendations for approval this evening. So again, loss ratios are the way that, I'm sorry, not healthcare, insurance companies provide school districts and private organizations alike with kind of how you're doing, right? So a loss ratio in a fully insured market, which is going to be, we provide premiums to an organization and they provide insurance, they cover all the loss, things like that. Those organizations are looking for loss ratios in the 80s, 85% produces about a 0% increase in premium. So essentially status quo. That you might go, isn't 100% zero, and that is the case, but then that 15% is the margin where they're making profit, right? So 100% loss ratio environment would be $100 paid in premiums, $100 paid in expenses. That would be a wash, essentially exchanging hands. So in a fully insured market, they're really looking for something in the 80s to provide some sort of profit margin for themselves, right? You can see here, the other big thing to look at from a loss ratio perspective is number of members that experience what's called high cost claims. This is consistent across any organization. You see high cost claimants in a self-insured or a fully insured market typically drive premiums. And so what districts look to do, organizations alike look to do, is to try to provide opportunity for people to get proactive care as opposed to having reactive care, right? We want people to see the doctor often, which is why things like your annual physical are free and they aren't subject to any out-of-pocket costs. Generally, you catch things early and typically people are healthier, right? So you can see here that 13 members in our organization make up about 1.5 million of expenses, with a total expense of about 5.8. That's about 25% roughly. So certainly something we'll have to look at and work on, but that's kind of the high level of the loss ratio. We then dove into our insurance across actives and pre-65s. So our loss ratio for as a group is 113. Our actives make up 107, so a small amount less, which make up about 90% of the total enrollment, but about 85% of the claims. Our pre-65 retirees, which is a group of about 85 individuals, make about 15% of the claims across the districts. We discussed that and how that impacts our loss ratio too. So when UHC gave us a renewal, essentially, if nothing changes, renewal came back at about 56%. That includes the underwriting calculation that they use to get there. Given our size, I think as Brown and Brown spoke to at the workshop, given our size and the organizations like UNI Healthcare, the amount of premiums we're paying and employees are paying, it's a significant revenue for the book. So we do get a discount off that. So that increase came in at just under 30%, which included our wellness funding and also our UHC nurse, which is a benefit for our staff employees. And you can see here the breakdown of what that would look like if you broke that out over our actives and pre-65s. But the big issue is that a 30% increase in premiums for any employee in the district would have a significant issue, or significant, it'd be contradictory to the compensation increase we gave last February, March of 5%. So we're certainly trying to move the needle on that, which is why our efforts are out there for staff to get an increase, be competitive. So moving backwards to maintain a benefit, I don't think is beneficial to our staff at this point. So the goal was, how can you maintain a high level employee benefit while also maintaining compensation increases to be competitive with the region? And so one of the options that UN Healthcare gave to us in the renewal was this ACO network. And really the main changes here for employees across the district or pre-65 retirees is that what United Healthcare does is they break up essentially all the in-network providers into two tiers. So the way that I've come to understand it is that United Healthcare, being a large conglomerate, can broker essentially deals with medical market insurers to go, hey, what does an x-ray cost here versus there versus at another place, right? So you can see in the tier one, you have Advocate Aurora, Children's, Freighter, and Medical College. Essentially, those are the hospitals in which they receive the best discounts as an organization, UHC, and they put them into their own tiers. And then tier two essentially is an in-network benefit still. So employees can still receive care in a tier two provider that's considered in-network, but the restriction comes in the plan design changes, which is outlined in this sheet that we discussed at the workshop. So the main changes here, which I'll go through, we have two plans for people to choose from. The base plan is a lower out-of-pocket premium and a higher deductible. And the buy-up is a higher premium, lower deductible. So you pay more per month, but when you go, it's cheaper, right? Or versus you pay less per month and it's more when you go, right? So people across the organizations get choices of, am I going to go to the hospital a lot? I don't have a lot of young kids, or I do, or, you make decisions as a family. And so people make those decisions, right? But the big changes here, you can see there's some deductible change with the base plan, but the big one is that a tier two goes from 100% coinsurance to 80%. So in our current market, if anyone goes to an in-network hospital, once the deductible is met, it's 100% covered beyond just your copay. So in 100% coinsurance, the thing you're looking at is what are the copays? Because the copays, if they're reasonable, that's about all you pay once your coinsurance, once your deductible's met, right? So if you have a significant illness in 100% coinsurance, you're in a much better place than if you're not in 100% coinsurance. And I can tell you that the 100% coinsurance is something where we look at employee benefits. That's like the shining star here. A lot of districts do not offer that because it's costly to the districts, right? So that was one of the things we set out to try to maintain is, can we offer insurance to employees, both pre-65 and actives, that has 100% co-insurance with providers that are highly used, right? That was what we set out to do. So you can see there are some changes here, but in tier one, Advocate Aurora Children's Medical College are still 100% co-insurance, tier one, with some minor changes across the base plan as well. Out-of-pocket maxes went up a lot, but remember, in a tier one, 100% co-insurance, you only hit that by going and paying copays and copays and copays. So it'd be very difficult to reach that. And I have some data to show you how many people did reach that last year, right? So again, disruption. This is a disruption analysis on provider. So how many people already use tier one? Again, about 80% of people already use tier one. So is there going to be some disruption here with people having to have the conversation as a family? Should we keep going to Ascension to the primary care? Yes, absolutely. Can they still go? Absolutely. But it does come with some financial, like if you go a lot, you're going to be subject to 80%, right? So those are discussions they're going to have. I don't want to minimize that. That is a lot, but again, we still have the option for those employees to receive tier one care at, from my perspective, great providers, Freighter and Aurora, and at 100% co-insurance in the market. From out-of-pocket perspective, you can see here only for people in the base plan, only 1.5% of people actually met their out-of-pocket, because again, that was in 100% co-insurance. It's very difficult to do. And then the buy-up, only 3.6% met it. And that number's higher. I asked Brown and Brown, like, why would it be double, right? 1.5 to 3%, not something you'd go crazy over, but it's still double. And the reason they said is that, well, in a buy-up, typically those are people who have family plans with multiple, you might have 5 or 6 dependents total on a plan. So to get to 1,500 across 5 people, it might not be that difficult, right? So just something to consider. But again, across our whole organization, about 5%, that's pretty low, right, from a disruption perspective. So again, the recommendation this evening is to split the groups, and we'll talk about that in a few minutes about why that recommendation is being provided, but we discussed that last month. But you can see here the breakup on premiums. So the total increase across the district is 9.4%. What that looks like in each group here, actives would be 7.7 to 8.1, depending on the plan choice. The base plan sees a smaller increase. The buy-up is a little bit bigger. Same with pre-65 retirees. The base plan at 26.9, the buy-up at 27.4. We briefly discussed the OPEB plan. I think it's important to note in this presentation, I think as an organization here, we've made some significant changes to our OPEB plan, which has been really kind of 2 different phases. The first phase was in 2021. We opted to move pre-65 individuals that were on district insurance to the AMP plan, which provided, in my opinion, both a significant benefit to those individuals as well as some savings to the district. So that you see the number of people that were on our insurance, pre-65 insurance, which would have been we at the time, jumped from 700 down to almost 100. So that was a significant drop. The next one, you see here that 99 jumps up in 2024. And then that drop is going to happen, not predicted, going to happen. That's due to, we had a window for people to early retire. So that jump, it's actually like people just getting on earlier, right? It's not really an increase. But that we expect that number to significantly decrease almost at half by 2027. So the OPEB plan's working, and the plan that we put in place was to help grandfather people, to give them options. And again, anyone that's going to retire that has the option for insurance also has the option with the plan to take cash in lieu of. So people have those options, which to me is a great benefit for people to retire earlier if they want, or not, they can decide. So I think the plan is working as expected. So the pre-65 breakdown, this kind of breaks out the different groups of people. Not everyone's in the same spot, because some people have insurance for longer periods of time. And this kind of goes through that. So there's, we'll go through each section here. There's 48 retirees on a 90-10 split. That is the district agreement at retirement. And each individual after their 3rd year, should they have insurance past their 3rd year, their 5th year, after their 5th year, they're put into what's called a benchmark. And that year they benchmark at what the district portion is. So this group of people, you can see here, a lot of these pre-65 retirees, almost 50, are all pre-benchmark. So even the increase that we showed at 26% produces an increase to someone that's single about $23 to $35 a month, 58 to 90, depending on if they have a family plan. But as you can see, About 1/5 of them are within 3 years of Medicare eligibility. This group, likely almost all of them, has the 90-10 split for the duration of their premiums. That's kind of how it worked. This group of 19 are at benchmark. What that means is the district's portions locked in until they hit Medicare. And you can see here, there's 19 employees infected. 8 of them are within Medicare eligibility of 1 year. That could be January. Some of them couldn't even be impacted by this, but within 1 year, because it matters on when they turn 65. It's not when the year's over. They get insurance up until their 65th month, right? Their 65th year, the month they turn that age, right? But a lot of the individuals here are going to be turning 65 and or their spouses do, significant others. So it's contingent on that. You can see the single group at 14, 6 of them received no change because the district's portion, it's a little complex. So when they hit benchmark, if they're on a family plan, but then their significant other turns 65, the district's portion is family. But now they're on a single. So the district's portion, even with an increase, is still more than the single plan is. So even with a 50% increase, they wouldn't see any change. Does that make sense?
Mhm.
So of that group, 6 of them won't receive a change. That's why I made that note there. Yeah, Kristen, go ahead.
I know we've had many workshops regarding this. Have we had people, have we reached out to people, explain what these changes could be? Because 5 families could go up $600 a month. And I just don't, I don't want this to be, I don't know if this is gonna be, like, was notice given to folks that this is what's being discussed?
Yeah, we didn't communicate to the mass group of people to tell them what will be discussed, but I mean, insurance and the renewal has been, people know that that's out there. Yeah, yeah. So should this be approved, there'll be sessions for each different active and pre-65 retiree to go through that. Yeah, yeah, yeah. And then lastly, the last group is there was 16 different retirees that are still on the district plan that retired with a 50-50 agreement. That was a lot of our specific employee groups, cleaners, custodians. This was the plan that they had when they retired. So this was kind of how that breaks out. But again, 9 of them are within Medicare eligibility within 1 year. So it's just important to know. I don't think it matters, but I think it shows you the duration of time at which this will be effective to them. So this is just a quick slide that Brown & Brown puts together to show what the impact is across our organization versus others. So you can see here, it's very difficult to read, but what they try to do is to give you a comparison of like, what do our district employee benefits look like versus the region? And you can see it's, again, it depends on which different group you're looking at, but across the Midwest school districts and in an organization with 1,000 employees, we are typically, from a deductible, out-of-pocket, employer co-insurance, we're typically either in line with or better. The only 2 we're not is the co-payment amount and the monthly contribution. But again, our plans are better, so people should probably pay more than other districts. So that makes sense. So this kind of like gives the data to back up that, yeah, from a benefit, health insurance benefit, dental benefit, we are doing better than other organizations. So yeah, that's just trying to maintain that focus there. So just final considerations before take questions or comments. So dating back 10 years, kind of going back a little bit, our loss ratio really hasn't changed a ton. And so it's something that I think from a expense perspective, we need to start considering how are we going to pull this back in. It was a large reason of why we did the OPEB plan. It was to get undefined benefits off our books. And so at the end of the day, if we don't move undefined benefits off the books, it just continues to be something out of our budget every year that has to be taken out of buildings, out of staff. It just has to come from somewhere. And so that's why these decisions over time have been very helpful to the district's long-term outlook from a liability perspective. I mentioned in 2022, I was off by a year, we moved the post 65s to Medicare Advantage. That was a great option because it gave post 65 and people that retired here a similar benefit at a significant decrease in costs, both to us and them. So that was a great benefit at the time. We talked about this before. There's less health insurance providers in a market where there's less of anything. It's just an economics formula. Essentially, there's less people to bid. And we've seen that across other agencies in the district. Transportation, similar as well. Healthcare costs, no secret to anyone, to keep going up. So really where we have to go at some point here is to move to self-funding, because the reality is to get to 9% this year, from 30 down to 9, we had to make plan changes. So to do that again next year, even an ACO network would be likely moving from 100% co-insurance to 80. And then we're gonna be in a similar spot as other districts with premiums that are far beyond. Right, so that's currently where we're at, and so I think, you know, in the short future here, until the OPEB plan works itself out, I think the recommendation kind of leading into it is to, one, move to approve the UHC ACO plan 9%, and then also to separate the groups. So that's kind of where I think we're at this evening. But again, open to discussion and conversation, so. And this, I can open it now for this.
So before we get to general questions from the board, I wanted to allow Ms. Kaiser from the committee. So this came out of your committee. So can you just give a brief synopsis of was the committee in favor of the recommendation that's come before the board, and was there any pertinent discussion that you wanted to bring up at this point?
As much as the numbers are obviously crazy, it's I'm trying to speak my words carefully here. It's all we've got. When we are losing insurance companies and there's a monopoly in the area on insurance, basically, and costs are going up. For our current employees to focus on them and their benefits and not making them have a 30% increase. I believe this is what's best for our district.
So the committee was in favor of the recommendation?
Yeah.
And I would note to, I think Ms. Kaiser's earlier comment too, like one of the things we discussed as well is, and I think a lot of post 65 retirees too, the wellness clinic is free for them. So again, it's not the same as going to the hospital, but a lot of people's medical appointments, they can designate them as a PCP. I mean, a lot of things can get done there. The labs, your physical, we have physical therapy there. So a lot of things can get done there. So in the off chance that, you know, an ER visit is warranted, you need to do that. Certainly it doesn't come with a cost, yeah. But, you know, I'm trying to keep other options open for people at a low cost. So there's something to note as well.
Questions from the board? Mr. Burns?
Can we look at the pre-65 breakdown for the benchmark retirees?
You mean this one?
Yeah.
Yeah.
So, one of the questions that just kind of came up this evening for me is a family plan at 55, 60 years old is you and your spouse generally. But the family plan is more than double what it would cost for 2 single plans. As options for people like this, I know it's not a lot, but $100 if it was to go up by 244, one per person would be 48. Is there any way to have them sign up for 2 single plans for that?
Yeah, good question. And the reason that is because the single plan, so the way the district insurance works is the district pays 90% of the least cost plan, right? And so the single can range from 230 to 244. And that's because in getting to the family, that's because a family plan, the buy-up portion of that, the district pays 90% of the base, right? And then the buy-up comes at whatever the increases comes at 100% of the employees. Same with active employees too. So like a single base plan's $80, a family base plan's $240, right? So it's more than double, which is what you're seeing here too. The reason we can't have people do 2 single plans is we're only eligible to offer insurance to the employee. Right, so similar to a family, you know, of active employee and their significant other, we couldn't do 2 single plans because that one person's not an employee. So
I think when we were talking about this, there was some options where you could have, but there's employee plus spouse versus a family, right?
Yeah.
So is that something that, is that a plan change in the future that could be considered that would reduce costs because you just have employee plus spouse versus a family plan?
So it's something that we could consider. The reason we haven't moved to that is because from a disruption perspective, we have about 30% of the people that have employee plus 1 plus family. And so what you're going to see is you're going to see costs from a employee plus like the people with multiple dependents beyond 1 are going to see an increase in premium. And so it's something we could do. It would drive down costs for someone that plus 1. you might see a premium difference. Obviously, you might see that come down $50-$60 a month, but it's something we could do. We have not looked at that at this point. Yeah.
Is this something that we could, would that have to be a global plan change, or is it something that we could do for only pre-65 retirees?
So we haven't, this is a carve out, so we could do something specifically for that, but since it's a broader increase, what you'd see is you might see a family plan here go from 588 to 630, it might go to 682 then. Like
Okay.
you'd see some changes within the plan itself. So since they are a carve out, we can do anything we want with that.
Got it.
Um,
If we approve that change.
correct, should, correct, yeah, yeah.
Okay. I mean, it's just good information to have
Mhm.
because Mr. Burns is correct. I presume most of these people are only this, them and their spouse at this point for who are on a family plan. And I do know that usually if you have a plan that is just employee plus spouse, it is cheaper than a family plan is.
Sure.
When all options are available there. So it may be something where we just get, if we approve this change, that we would get rid of the family option.
Yeah.
For that group of employees and then move to just
Yeah.
single or single plus spouse.
So what I'm getting at is the only way to see changes here is if there is someone on a family with multiple, more than one, because the total cost of the group is the total cost of the group. So you're just dividing up where it goes. So if half the room is employee plus one and the other half isn't, yeah, then you're gonna push costs to the half that isn't and keep the costs here lower. But if everyone's employee plus one, the total cost, Do you see what I'm saying?
I do. So I guess the insurance company is charging the same amount regardless if you could cover everyone in your family
Yeah.
or just you and your spouse.
Because in this group, that's what the loss ratio dictates for this group.
Got it.
Right, yeah. But if there was one person that had, then they could break it out, yeah.
Got it. Okay. Other questions? So one thing I just think I wanted to note about this is that I see this as part and parcel of the retention piece, which Aaron talked about. In that, especially with the referendum, we're trying to do is increase salaries. But if we got our benefits, the salary piece isn't going to be as impactful on retaining staff, because one of the things that we do have that are better than some other districts, as Aaron pointed out, is the benefits. So we see the writing on the wall here a bit about what next year could bring for our district. And so by trying to mitigate those costs now and make those changes now, the hope is that when next year comes, we would be in a better space. And then if the referendum also passes, then we have kind of a very overall good salary and benefits package, which would be more competitive in our area. So maybe you go somewhere else, you get more salary, but your benefits aren't even close to what we have. And so that makes a difference, especially for teachers who are going to be having families or have young families. Like, benefits are a big deal. So I think that, and that's, we want. So I think this is kind of the first step in that process. And then hopefully the second piece falls together in November. So I think it's important to point out here. We understand this is going to be a painful thing for some people, but overall, for the benefit of the majority of the district, the majority of our staff in the district, this is probably the best bet for us to make.
And I would say too, I know if you have questions, I'm happy to answer them too, but I would say, like, one of the benefits of having Brown and Brown is that they can meet with staff at any point to discuss insurance options in the market. Some people, and I've had these conversations, like some people that are on 50-50 have gotten off the plan and met with Brown and Brown because they can find a plan that is better. That is employee plus one, or they go, well, no, because they can get into the weeds of like, what are the hospital? Well, I only go to this hospital. Okay, so we're gonna limit the network to one. And I only ever use urgent care. Like, okay, so you want a high emergency room? Yeah, sure. Like you can get really specific. And so with having, I would say under 10 people who are going to have some significant impacts, they might be able to develop personalized plans. They might find better themselves. I can't guarantee that, but I think that I have been in the room with conversations like that where people have left happier. So I can speak to experience there that can be the case. So,
I'm really glad you brought that point up.
Yeah.
Any other questions from the board, Mr. Burns?
With that, is that an actual like talking point that Brown and Brown is like, hey, this is a really expensive up, but we could look at some doing that? Like, do they actually approach it to sell them something different? And I say that because if the retiree comes in just mad because their premium went up by $600 a month. I can't afford it.
Mhm.
Like, if someone doesn't say, we have options, here's what you can do, and this would be cheaper, like, is that a talking point that they have?
So typically, what we'll do is, so leading up to this, just like with last time we went through United Healthcare, we'll work through kind of a. Here are the updates, and then like, what's the next step for you? And it'll be broken up into 3 groups. If you're in the 90-10 group, this is kind of what it'll cost you. We're happy to meet with you and discuss that. Maybe they want to sit down and have a meeting like that, right? But typically where this ends is if you would like to explore other options, please stick around after and we like set up a meeting with them to sit down, because it's more of a, we need to like sit and have a full, they need like a bunch of information, and then, there's releases and things like that they have to get into the weeds on. But typically, yeah, what they'll do is it's like shopping for car insurance, right? They'll submit all this stuff out to the market and see who is able to insure. And with individual people, it's a lot easier to get insurance, especially on the ACA, I think it's called, where they can look through
Marketplace.
those. Yeah, so I mean, they can typically find other options, then at least people have all the information they have to make a decision, at least, so.
Other questions? Otherwise, I'd look for a motion.
Move to approve. Second.
Moved and seconded. Any last minute discussion? All those in favor? Opposed? All right, that passes. Thank you very much, Mr. Norris. And that is the last item on our agenda this evening. So I look for a motion to adjourn.
So moved.
Second.
Moved and seconded. All those in favor? Aye. Opposed? Right, we are adjourned. Thank you very much, everyone.